Welcome back, everyone, to another edition from the Disruptive Dental Science podcast presented by Dental Advisor. My name is Dr. Ashton Prince, and I am one of the clinical ambassadors here at Dental Advisor. And I'm joined today by Dr. Jeff Lineberry. Jeff, it is an absolute honor and privilege for me to have you on. Thank you very, very much for joining me today.
Well, thank you for having me today. I really appreciate the opportunity to hop on here and have some discussion.
I love the discussions out of this. So Jeff is one of those dentists. He's been in practice for about 25 years.
Yes, this is about 25th year in clinical practice since I graduated dental school. It's hard to believe that time flies
Pretty quick, doesn't it?
It
So
does.
he's one of those gentlemen that if you look at his name and you look at his accreditations and accolades and things like that, you start to lose yourself in how many letters actually follow his name. He's a fellow for the American Academy of Cosmetic Dentistry, or actually an accredited member of them, a fellow of the Academy of General Dentistry. I even got myself lost in this, in the FICOI, the fellow of the International Congress of Oral Implantologists. I mean, the things that you're involved with, the things that you do, being a visiting faculty for Pankey and for Spear, and all the things that you do with the Spear Education Program, you've had your hand in so many different things. I'm really, really curious to know, you went from starting practice 25 years ago. Now you are even a chief clinical officer for your Bella Family Dentistry and for the DSO that you're associated with. What fueled you to be going through all this? And really, what has been your passion in dentistry and gotten you to this point?
I mean, I would say that, what's kind of fueled me along the way is clinical education has been a huge part of my career, obviously. But, the thing that I've learned being outside of the office is the interactions with other practitioners, not only the education, but the camaraderie that I've gained over the years being outside the office. As you mentioned, I was in clinical practice for 24 years in private practice. During that time, I actually transitioned a couple of times. I was in a fee-for-service practice in a small mountain town in North Carolina, and then I sold that and transitioned to my current location. And I was in that current location for almost 12 years, and then recently transitioned over into chief clinical officer for a small DSO that's fee-for-service based. I've kind of been all over the place. I was very fortunate early on in my career that I got involved with someone who was involved with the Pankey Institute, and they were very passionate about dentistry. They loved what they did, and I'm like, hey, what's this all about? So it's like, so you can actually enjoy your career. And so
That's weird, right?
so it's one of those situations where that kind of fueled my fire for education. And it also kind of inspired me outside the office of being involved with continuing education, because I wanted to be able to give back to the profession. But then also these mentors of mine fueled my fire to enjoy what I did. And that's like, hey, I want to be able to do the same for others.
Oh, that's absolutely beautiful. When you started getting into private practice, there was a moment, like you said, you had it with Pankey and you were introduced to a few things, different mentors, different groups that started to allow for you to see that there was something more so than just the clinical dentistry in a private practice. So when you first started down that avenue, down that line, and you started to realize that there was a lot out of continuing education, which I am a sucker for, I can't get enough of it, was there something that finally allowed for you to say, it wasn't a burnout, I would guess, but something that told you that there was something that you could offer that was more, that you felt almost this drive to be able to do this for other people and to continually educate yourself more on what is actually out there so that you could learn more for yourself?
Yeah, I mean, I think that there was just various points in my career that as I got involved with it, I had a couple opportunities to start to do a little teaching in small group settings and study clubs. And then I still remember some of my very first few meetings that I had the opportunity to speak at. And I was very fortunate that one of my mentors and good friend, Leanne Brady, she afforded me the opportunity to get involved with one of the state dental meetings here in North Carolina. And, I still remember the butterflies in the stomach of getting up in front of people. And I'm like, what am I doing? I don't think I want to do public speaking or get involved in anything like
Sure.
that. And yet here I am doing it more and more. And I was just at the AACD last week, and I'm the chair of the Get Back to Smile Board of Trustees. And
Nice.
And so I had to do a short little brief intro of about 5 or 6 minutes talking about our organization, but still had to get up in front of 500 or 600 people. It's amazing how I get empowered or excited about being able to share with other people and make an impact on them.
I love it. Now, the butterflies never seem to go away. No matter how many times you do this, the butterflies always seem to be there right before you get on for any of this kind of stuff. And Dr. Brady is amazing. I will agree with you there. So, as those that are listening and can understand that we've got somebody on here with us that is extremely knowledgeable, very understanding of the profession, and almost all of its avenues that we can actually even associate ourselves with. So, Jeff, if you wouldn't mind, kind of guide us through the things that you actually see of need that those that are out there are needing to better understand, to be taught, to be guided upon, to be mentored in. What seems to be the going topics right now?
There's all kinds of topics. I mean, obviously, there's plenty of things happening in dentistry. That is one of the exciting things about dentistry right now. There is a lot of technology that's going on right now. There's tons and tons of continuing education. I mean, there's paradigm shifts within the industry. I think right now within dentistry, I don't know that there's really a stone unturned, if you will. And it's kind of like, I think when we started having this conversation of what could we talk about, what would be impactful. One of the things that as I've kind of shifted over into my current role is that I have found that a huge piece that we're not taught in dental school outside of the business stuff is leadership.
Sure.
And so when you start looking at leadership within your practice, I mean, what most doctors and dentists don't realize is that when you get your DR in front of your name, is that you're automatically a leader. You're a leader to your patients. You're a leader to your team members. You're a leader within your practice. I mean, it becomes almost a given, but it's kind of one of those titles that you're given, but you're like, wait a minute, I didn't sign up for this. I just want to do the clinical dentistry.
Ready or not, here it comes at you.
That's right. One of the challenges that I've learned personally, but also now being able to see it on the other side as I work with our clinical doctors within our practices, is that a lot of times the common thing that, and I do this and so many practitioners do this on a regular basis, is that we step into dentistry, we want to get busier, we want to have the great team, we want to have all these things. And so the first thing that we start struggling with is clinical stuff. And so then we want to go and we want to get some clinical skills because, well, we want to get busier, we want to get better. And so we go to Panky, we go to Spear, we go to AACD, we go to all these different places and we get our continuing education. We get so excited, we get fired up and bring all that energy back to our practice. And then, a couple of weeks go by and then it finally starts to fuel out of you and you're back to normal again. That used to be a running joke sometimes with my team is that, oh no, what is he bringing back to the practice this time? I know you're laughing because you're like, I've been there.
Because I've done the exact same thing.
Exactly. And so what we find as we get more with clinical skills is that we're wanting to incorporate more of those into our practices. The challenge is that we start to struggle and have challenges with that. A lot of times when we're doing that, we're ultimately looking at doing things where we think that if we develop our clinical skills, we'll see more, we'll do more, it'll create business and growth, and then we'll get busier. And then eventually we get to this point where we're so busy, it's like, oh, well, I guess I better learn how to run a business and maybe I need to become a leader too. And so what I've come to learn is that it's almost like I feel like sometimes we're kind of doing these things a little bit backwards. And I know that's a different way of looking at it. But a lot of times, if we start thinking about our leadership skills, if we develop our leadership skills of where now we can develop our team and the right culture within our office, that same energy that we bring back from our excitement, our team is now excited for us and they're ready to incorporate that into our practices. And as you know, you get into going out and learning a lot of these clinical skills and you want to bring them back and you want to incorporate them into your practices. I mean, that's one of the huge things that we see within dentistry is that we learn these wonderful skills, but then we have trouble with implementation. And if we have the right team and we have the right culture within our office that embraces that change, it's going to be far better for you to be able to incorporate that into your practice.
Sure.
And so that's one of the things I've almost had kind of a mind shift or paradigm shift in my own mindset of, we really need to have the right team and those leadership skills and develop those communication skills. And that way, then when we do go get that CE training. We do learn new skills. Then, we've got the patients that are there. We've got the team there to support us. And basically, I mean, all we got to do is put a little wind in the sails. I mean, the ship's already pointed in the right direction. So it's definitely changed my mindset on things.
The phrasing that you use, the creating of the culture that you need with your team and with your groups that you work with, I was always a little confused as to why it is that the rest of my team did not have the same desire, the same drive after I would be going to different courses and saying, guys, this is what we can now do. These are the different avenues of the different topics or the different procedures we can now offer. Why aren't you guys as excited as I am to be able to offer this to our patients? It'll be so much better for them. They just didn't understand it. They didn't have the buy-in because, as you said, they didn't understand the desire for it themselves. They didn't have that drive to be in the same position to it. So if that is the case, if we have this paradigm shift that's in reverse, as soon as you said that, I thought, all right, where do I need to begin with this? Does sound like it is within the avenues of becoming a good leader, which you are very, very accurate with. That is something that we are not taught in dental school by any aspect of it at all. In fact, even being a business owner or a leader in all aspects, I guess.
Yes.
We really are not taught that whatsoever in dental school. They will teach us how to do certain clinical aspects of things. That's fantastic. But then it's up to us to start to develop ourselves. Many of us have that drive. Many of us do not. And those that do not seem to burn out very, very fast or look for different avenues to say, well, I don't like this anymore. I don't like being a team leader. I don't like this. I want to do something else or leave that to somebody else. So where do we begin? How do we get that leadership skill?
First and foremost, you got to recognize that, hey, that's something that I got to work on. To your point, it is a get to know yourself. And that's one of the key pieces of, we talk about it, thank you, is the cross of life. And one of the pieces that we talk about is get to know yourself. And that is developing the leadership. So, where do you start with that? Well, first, I mean, I've always said that it's so important to surround yourself with like-minded people. So,
Nice.
So that's always, I think, is a great place to start, is to kind of develop that circle, if you will, of being able to have similar people that you think, man, I would like to emulate or assimilate how they run things, how they do things. I really appreciate how they have a phenomenal practice. They have, they're doing something right, if you will.
Yeah.
I think that's first and foremost probably a huge thing, that you need that core of people to support you in the process. Other places that I've gotten that from is that I've gotten it through reading leadership books, listening to leadership books. I've been involved with some leadership potential. I'm very fortunate. That was one thing that kind of brought to my attention early on at Panky is that I actually spent a week at Gallup University back in the day at their Great Managers program, learned some stuff about leadership. I was just at Spirit Education the other week, and they see the importance of leadership within our faculty group. So we actually brought in the Echelon Front group, which if you're familiar with them, you start seeing things so much differently when you start looking at the whole leadership piece. You start looking at the different avenues. I've listened to a lot of different podcasts. There's a lot out there in the leadership piece that you can start looking for.
Sure. I've always looked at it as the grass is greener on the other side, that you see somebody that has something like, that's what I want. That's what I want to acclimate towards. That's what I want to be. You said that there was a number of books. Have you got any books right off the top of your head that you think that this is something that's kind of turned me as well?
Yeah, I mean, one of the things that I've learned is, of course, early on, I read Stephen Covey's 7 Habits of Highly Effective People.
Nice.
That's a solid one there. And I remember reading it and making notes on it. And I still go back through and look at it from time to time. Recently, I read 5 Dysfunctions of a Team from Pat Lencioni. There's a lot of different leadership books out there. I listen a lot to John Maxwell as well, Maxwell Leadership. We've actually had a leadership program in our organization. We had someone come in from John Maxwell's group as well.
So you can look to books, you can look to podcasts, you can look to mentors, you can look to coaching teams, you can look to a number of different avenues to at least gain that leadership dynamic to it. And if you have that drive, then by all means, there are obviously some avenues that are out there. Now, a lot of people will say, well, I just don't have time to be able to do all of this. What do you say to that?
I'd say that you don't have time not to do this. And the reason I say that is that I love clinical stuff. The thing about it is that oftentimes I see so much in the world of dentistry that we want to talk about the clinical aspects of things. And I love clinical dentistry, don't get me wrong. But what I will say is that when you have the leadership piece of it in place and the communication piece of it, the implementation part of doing the rest of it, it just makes it flow and makes it a lot more efficient. So if you think of it as a catalyst for being able to implement those clinical things in place, then you realize that why wouldn't I do something that would actually speed along the process and actually make that process a lot more effective and efficient going forward?
Nice. So let's say that you did start down the avenue of becoming a better leader. You have to understand you are going to fail at times with that as well. You're not going to do things perfectly, and that's completely acceptable as long as you learn from those and you pass that energy along to your team. And speaking of which, if you do feel like you are starting to gain some of those qualities, how do you pass that along to your team?
So a couple of things that's really kind of came to mind as you mentioned leadership, you will fail. And some quotes that I remember specifically, I heard one from John Maxwell one time. He said, "There's no two good days in a leader's life." Because, and you're laughing because I'm like, man, I've never thought about that. But every day leaders take on challenges. And then I
Mm,
can't remember who said the other one is that, leaders accept all the failures and they let their teams have all the wins. And that kind of goes back to Simon Sinek. That's another
yeah,
one that kind of popped up in my head is that Simon Sinek is another great one as far as leadership and communication.
absolutely.
But, I mean, how do you instill that into your team? Well, ultimately, it starts at the top. And that's the reason why I think it's so important to have those skills present for yourself. And a lot of times that gets emulated throughout your organization. In other words, there's an old saying that we've said before here in the South, the fish smells from the head down. So, and it's true. In other words, if you don't have strong communication and leadership skills at the top, and then when a lot of times your team is a reflection of that.
Yeah.
And so one thing that I've really kind of picked up from Ashton Front and going through extreme leadership is that we have to take an extreme amount of ownership in what we do. In other words, we have to take on owning everything that happens within our practice or organization. When we do that consistently and not point fingers, that's where it kind of begins. It begins with you ultimately. And that's the reason why I feel like it's so important to have that part of your organization.
There's this you said this is a kind of a paradigm shift in the way that you've been thinking about things. When we talk about the importance of becoming that leader and passing that along to team members and what that actually does for patients as well. For me personally, whenever I'm hiring on a new team member, I'll tell them that I've always had this mentality that it is the team comes first, not the patients come first. And if I can support and uphold my team and get them to drive themselves towards wanting to be better, then that will then reflect upon our patients, and they will also feel as though they are being taken care of in the very best manner as well. But even just as of recent, as of last week, then I had one of my assistants that did something a little bit incorrectly. She just white-faced tears at the end of the day. She said, "This is my worst day. I can't believe I did this." I said, "Okay, let's start off with it." And I did. I took it upon myself. I said, "It means that you weren't trained well enough. So don't let this be something that affects you. Let this affect me, that I have now realized that there are some certain things that I need to train you on a little bit better so that that doesn't happen the next time around." And she looked at me and the tears did stop. She kind of looked at me and she goes, "But this wasn't your fault." I said, "You have no idea. It actually was my fault because I should have trained you better for this." To have that mentality, that can be learned a bit, but humility is a big aspect of this as well, correct?
Absolutely. And I'll add the piece of not only humility, but vulnerability.
Yes.
And that's another one I was thinking about. Brene Brown is another one that even though Brene doesn't get into the whole leadership thing, but I mean, that is a huge component of being a leader is being able to be vulnerable. And as you said, I mean, I think that's awesome when you step into taking on that ownership, just like what you did with that. That was a wonderful example of how that's what we call extreme ownership is that, and it takes that pressure off them and they realize like, wow, and that will disseminate throughout your organization.
Right.
So,
Well, when you said earlier at the beginning of all this that no stone has been unturned at this point in dentistry for the most part, but things like this, even conversations like this, I don't think 20 years ago when I first started in this as well, that any of this would have been a conversation we'd ever have regarding my career in dentistry. Why do you think this is such a big deal these days?
you mean as far as the ownership and leadership piece?
All leadership, communication skills, trying to gain the team draw and energy and everything else. Everything else used to be you learn these skills, you implement in your practice, you dismiss your patient, you're done. That's not the way that dentistry is anymore.
No, and the thing about it is, there's so many pieces of, as I mentioned earlier, I mean, everything's changing within dentistry. But one thing that I can tell you wholeheartedly is that leadership and communication is a core foundational principle. That hasn't changed. And if anything, to your point, it is needed more now than ever. I think we can all agree that post COVID, things have changed a lot in the world in general. And what I can say is, especially within dentistry, the need for communication and leadership and having that great team is huge.
Well, what tips and things have you got then when it comes to trying to gain better communication with your team? Because I said it beforehand, of a culture needs to be set. You're going to have an assistant that's going to leave. You're going to have a hygienist that leaves. You're going to have an office manager that leaves. Things will happen. But as long as the culture is set that you have established as a leader, then it seems to continue. The wheels continue to turn. So what tips and tricks would you potentially have for those that are listening in as to how they can improve not just the leadership, but the communication skills, their impact with their team as well?
So a couple of things that kind of come to mind. First and foremost, a huge key thing for all this is trust. You have to make sure that you have trust within your organization. If you don't have trust, then it's literally like a cancer within your organization. So you have to create a culture of trust. That is a core principle of what you do. The other piece that I would say is that you need to have regular team meetings. I know that sounds counterproductive in this day and age,
Not.
but it's one of those things that everybody goes, "Oh, I don't have time for that." And but what I will tell you is it is so important to carve out that time to develop regular team meetings, so you can communicate with your team, talk through things. And not only do you need these formal ones, but you also need to have some informal ones. You need to
Yeah.
get the team outside the office and build the team together, and where they have that trust and communication that they have outside, and the relationship, because those relationships within the office cultivates that trust. And then, like I said, then that just spews out from there. I mean, that's the core.
Yeah. Like you said beforehand, you almost can't afford to not do these things. The team meetings themselves, from every coaching aspect I've ever heard, from every mentor that I've ever had, they said if you don't have these meetings and things and then actually use those as kind of a mental game of this is still time in the office. This is still valuable time that is there. It's not that it doesn't have production time. It's a different style of production that you're actually associating with these meetings. And being outside the office, that's the times in which these, at least for my team themselves, that they value the most, to be very genuine. They love the camaraderie amongst each other. You
Mhm.
create that culture, and I think it is invaluable. But if you don't spend the time for it, I think you really are missing out. Thinking that there's better ways to spend your time. No, there's not.
Yeah, and you're exactly right. And the thing is that, this goes back to an old saying, a penny wise and pound foolish. A lot of times we think, oh, we're going to spend a little bit of money doing this, and I don't have time to cut a couple hours into my production and so on and so forth. But pays huge dividends, as you know. It sounds like you're very familiar with that thought.
For the most part. But what I'm loving about this, though, Jeff, is just a conversation between you and I. I mean, we've been talking now for about a half hour about this, and nothing of this conversation at all has been associated with what's the proper way to cut a class two. What's the proper way to set your patients up for treatment planning acceptance. It's because a lot of that stuff that can be learned, that can be taught in different avenues. But to have a conversation like this with all of your accolades that you have, to have this be what has actually driven you the most means a lot to me personally in what my career has been in dentistry, purely because there's a lot of us that think the same way with this, that there's a lot more of a mind game. There's a lot more of a mental aspect that comes into this to culture that dynamic that we actually really want to have. So I will ask, is there anything else that you actually want to try and kind of throw into this? Because I'm loving this so far. This is speaking my jam. I mean, I'm loving everything about this.
Well, the thing is that, to your point, I mean, I remember you saying it earlier that you were discussing the whole piece of burnout, and that's another huge thing. And actually, last year at the Panky Symposium, it was one of the things that I shared is that I did a section on mental health within dentistry.
Nice.
And to your point, here again, you start learning these components of leadership and communication and how impactful it is within your practice. And so here again, it leads oftentimes to burnout within the office. So yes, I love this stuff. And that's the reason why people go, can you talk about cementation? We're talking about bonding protocols. I mean, we could talk about all kinds of new technology, but the reality of it is that new technology is going to continue to change. I think we can all agree on that, that there's, I would say, an industrial revolution within dentistry, but it's the digital revolution within
Yeah.
dentistry. But the leadership and communication piece, unless we get some robots within the office, it's going to do a much better job than we're still in the analog world of having to communicate with people, including our patients.
It sounds like that's coming as well. That's the scary part. The thing that I love though, and I'll just give a quick plug regarding Dental Advisor itself and what it is that we actually do. I mean, a lot of the things that we go through is obviously evaluations of materials and products and processes and where to use things and how to use things. And that's fantastic. And we do have to go through those conversations as well. But to have the understanding as to when to implement those things and how to implement those things more so than just in the clinical state, I think is one of the things that I loved most about Dental Advisor when I first got started with them a number of years ago, is that we understand that this is not just clinical when it comes to our careers in dentistry. You've been doing it for 25 years. I'm almost at 20 years myself. And to see the things that have changed in even that short of a period of time, not just materials, but the entire mindset to it, I think is something that you've got to kind of roll with a little bit. So a lot of the times when you go to these conferences and courses, it's not always just about clinical aspects. Like you said, it's mental health. It's understanding why it is that we do what it is that we do and having that drive us as to where it is that we go next and making sure that your team is right there with you. Because if they're not, that's a situation, a scenario that they don't want to be in. And I have said that a number of times to my own team members. If this is not the right place for you, if you don't feel like this is the right place for you, I don't want to try and talk you into staying here. I want you to thrive in whatever direction you want to go to. So find something that actually drives you. But as soon as you find that team member that has the same mentality that you have, that is the person you never want to let go because they also drive you right back in return.
Absolutely. Yeah. And to that point, I mean, that goes back to a core value piece. That's another huge thing is that a lot of times in dentistry, we're looking for team members that have certain technical skills or how much experience they have. But what I can wholeheartedly tell you is that people can have all kinds of technical skills, but if their core values don't align with you and your practice, it's an uphill battle. But if you find the person who has the right core values, the skill sets can be taught and trained. And to your point, to your dental assistant, I mean, obviously she deeply cares about what she does. And I can tell that you do as well. So with that, those core values align. I can tell you right now, she's going to always want to try to do her best. It's not that you can't teach that skill.
Yeah. When all of these things start to come together, when the puzzle starts to come together, that's honestly when the burnout mentality was gone, when I actually started to enjoy what I was doing. That's when I lifted my eyes up and started looking around, just kind of like what you have done years ago, and looking around thinking, there's more for this that I could offer to the dental field, that I want to be able to be available to others that don't quite understand this, and to be able to drive them in the same way that I have been driven because I've seen the impact it's had in my own life. You'd agree with that, yeah?
100%. Yeah.
I love it.
Yeah. And it made me think too, I mean, as a side note, I was thinking about talking about the burnout. And the other thing that I think that you get to a point in your career where you start to learn about the leadership and developing that team. And I think you can probably agree with this is that you get to that point where I think part of the reason why we kind of get into burnout is that we feel like we're alone and we have to do it all ourselves. And all of a sudden, when you start to finally realize that if you develop the team and develop your leadership skills and communication skills, it's amazing what your team members will do for you. And it starts to lighten the load. And all of a sudden, you don't feel like you're the only one in the boat rowing.
As soon as you notice that you are not the only one there, that everybody else around you is trying to do the same rowing of their boat, but they almost want to put their horse blinders on because they almost feel a little bit ashamed that they're in the position that they are. If they would just reach out a little bit and allow for themselves to be guided by somebody else. It's the main reasons why I even started it at Spear Education back so many years ago. It's because I felt like there was something out there. And then as soon as you start meeting people, you start learning different things, you realize that that pool that are all in the same mentality are all right there. They just need to have their opinions validified. They just want to know that there's somebody else that's out there. So this is, I love this, my man. I mean, this is such good stuff. So again, for those that are listening in, you can learn a lot regarding the materials and things. Go to our website, the Dental Advisor website, www.dentaladvisor.com. Take a look at some of the things that you can actually use clinically to put into your practice. But as you do so, have that aspect of humility. Look around and see if there are things that you can actually improve in your own office and your team. And if there are avenues like this otherwise, obviously find Jeff. I did a while ago, but to have this kind of a mentality for you to be able to be driven to being better at who you are as a leader, as a team member as well, as just a clinical dentist, there are so many different avenues that we can find improvement in. So once again, Jeff, thank you very, very much for spending a little time with me here.
Thanks so much for the opportunity, and really enjoyed the conversation. So like I said, it's my jam too.
This is good stuff. So once again, from all of us at Dental Advisor and the Disruptive Dental Science Podcast, it's been a joy to have you. We'll see you next time. Enjoy.